Hi guys, I'm Kerri. Now last time we spoke, I promised that we would continue with our videos about some of the struggles that we experienced during our sexual lives and journeys together. Now, I wanted to concentrate today on a sexual dysfunction called premature or rapid ejaculation. Now, this affects the guys as well as having quite a big impact sometimes on their sexual partners. So the medical profession define this as ejaculation which occurs between 1 to 2 minutes of penetrative sex. But sometimes men who can go as long as even 5 minutes still find that this is not long enough to bring themselves and their partners a significant amount of pleasure from the sexual experience. Now let's have a look at some of the causes for premature or rapid ejaculation, and then towards the end of the video I will show you how to do a self-stimulation exercise which might improve your timing and control. Okay? So sometimes men can go for many years without experiencing anything like rapid or premature ejaculation. And they have long-term relationships and many sexual experiences. And then suddenly they find themselves with a new partner, someone they're crazy about. And the first couple of times they make love, panic. No, they've experienced rapid or premature ejaculation for the first time in their lives. So the good news is that it is probably caused, I would say, from the heightened arousal and excitement levels of being with a new partner. Now, if you can manage not to panic, I know, easier said than done, perhaps for the first few times, if this does happen to you, you might get a second erection that you can use to pleasure your partner with, or take the focus away from the penetration and find foreplay and other methods of bringing your partner pleasure until things have settled down for you. The same thing might be occurring if you've abstained from any sexual activity for long periods of time and then suddenly become sexually active again. You might find that you can't quite control your timing as well as what you did previously, and that a little bit of practice and this will start to calm things down. However, there are some cases where men might develop rapid or premature ejaculation in response to a sexual challenge and difficulty of their partner. Sometimes men develop rapid ejaculation if they know their partner finds penetration uncomfortable or painful. Perhaps they know that their partner has very low sexual desire or doesn't really enjoy sex, or perhaps their partner is working through issues from the past, such as sexual abuse, and the man responds to this, responds to the difficulties of his partner by developing rapid ejaculation. In cases like this, I would strongly suggest both of you to have couples and relationship counselling with a sex therapist you both like and trust. And also, if you are experiencing pain during intercourse, it might be a very good idea to seek medical help. Now, I was saying to you that I was going to tell you a little exercise that you might be able to try that will help you control your timing a little bit better. It's called the stop-start method, and it's a self-stimulation exercise. So guys, find yourselves a nice, comfortable place where you're confident you're not going to be interrupted. Now, the exercise will only work if you can get your desire and arousal levels up. So you can do this through your own fantasies and pornographic material such as magazines and movies. So once you're aroused, take the tip of your penis in your hand, move your hand down to the base, back up to the tip, back down the base, up and down. Now, what I want you to do as you're doing this is to become aware of all the sensations that are happening in your penis and throughout your whole body. There might be parts of the penis which are more sensitive. Start to become aware of this as you move your hand up and down. And start to recognise what happens in your body just before you ejaculate, before that point of no return. And start to become aware of those sensations. But stop. Let the arousal go down, 10 to 15 seconds, and then recommence the exercise. So what we're trying to do is not to ejaculate, but just become aware of the sensations before you do, and stop. Do this 3 or 4 times throughout the exercise, and 3 or 4 times a week, until you feel a little bit more confident. Now, if you do feel a little bit more confident after a few weeks practice of this exercise, try the same exercise, but this time with lubrication on the penis. And try to focus more on your own fantasies and become less reliant on the pornographic materials that you have there for your arousal and desire. Now, sometimes if men do find that they have extremely hypersensitive penises, they do this exercise but use an anaesthetic gel, cream or spray, or a condom that has an anaesthetic cream in the tip already. However, this is only if you're extremely hypersensitive, and you do have to beware, guys, that you don't want to become so numb that you can't feel anything. Otherwise, the exercise is not going to benefit you. You also don't want it on your hands and genitals when you have sex with a partner, because then you're going to make them numb as well. So this exercise might be able to help you gradually recognise all the sensations, your thoughts and your feelings together, to help you be able to better control your timing of your ejaculation. Okay, I hope this has been helpful, and next time we speak we'll have a little bit of a further investigation into some other sexual issues that might be causing us difficulties and challenges then. So until we meet again, be good to yourselves, good to your partners, and we'll speak soon. Bye.